Are we in? We're in. Good morning. Good morning. Welcome. Happy Wednesday. Oh, it's good to be back. If you're listening, could you just drop a 1 in the chat so that we can find out if everything's working as it should and you can hear us clearly? I can't actually see the chat, so that's a good start. Awesome. Peter, I recognise that name. Prash, welcome. Ellen, good. Thank you. Thank you. Brilliant to see you all here. It's been too long. We know that. We acknowledge it. I am sorry. My bad. Right. As you know, though, it has been a very, very, very busy time for us all. So I think it's just worth acknowledging at the top of the call. We are now in, drumroll please. That's your cue, Melissa. Yeah, thank you. Over 3,500 surgeries across the country, which is huge. It's a huge, huge feat. And it's taken a mammoth effort from everyone here at Exon Health, the Exon Health family, the SCG family. But I also just wanted to give some credit to you guys as well. So a huge thank you for all the patience, all the support, for the teething problems and everything else. We are coming out the other side. The webinars are back. We're feeling good. But with that in mind, it would be nice, I think, with such a spread across the UK, to find out where you're all tuning in from. So if you could just drop in the chat which city, which town you're calling in from. I feel like I'm on the Eurovision all of a sudden then. Neil Poix. Taunton. Lovely. Blackpool, Somerset. Wow. Nottingham!
Hey, one for you.
Okay, there we go. Fantastic. Fantastic. It's great to have you all on the call. It's great to have such a spread across the country. And I think that's a real testament to all the work that we've been doing over the last few months. So welcome. For those that are new, the usual bit of housekeeping before we dive in. Firstly, to say that the call is going to be recorded for prosperity and sharing. So you're not going to miss a thing if you need to drop off. We know that you're busy. Second of all, we love the questions. So please feel free to ask them at any point in the chat throughout the call. We'll get to them when we can. Right, without further ado, my name is Lucy Glynn. I am the community manager here at Exon Health. With me today, we have our head of product, Melissa Lato, and fresh, thank you, Melissa, and fresh from best practice, our brand new colleague, I'm allowed to say, Max Gatlin. Welcome from Hanley Consulting. How are you guys doing?
Very good. Excited. Very excited for these updates that Melissa's got for us, and very excited to show everybody what we're bringing to the party, part of the Exon family.
Oh, the party. My kind of words. All right, good. And have you come down from the excitement of last week yet, Max?
Just about, yeah. A well-rested weekend and ready to go back at it this week. Yeah, just about. Amazing conference. Great show.
Were many of our audience today at Best Practice? Perhaps a little too in the chat if you were. Be good to see. And whilst you're doing that, I'll ask Melissa, how are you feeling?
Yeah,
3 months off doing the webinars. I bet you've got plenty to talk about.
Having a little relax, making sure I'm making some nice product for you.
Making some nice products. Making a product. All right.
Making a product.
I just wonder, Max, for those that have been living under a rock and haven't seen yet, what was the big news at Best Practice?
So the big news announced, yes, at Best Practice on Thursday morning, 8 a.m. is that Hanley Consulting is now a sister company to Exon Health. So we're working in direct partnership with Exon Health. And the reason for doing that is sharing, and we'll come on to this a little bit later, but all of our data insights and our expert knowledge around the broader spectrum of primary care and digital access. So as a joint force, we'll be joining forces to deliver even better outcomes beyond the telephone systems and into all various elements of patient access. So can't wait to show you a little bit more about that later.
Oh, you tease. It is exciting. There is so much to get stuck into. So I mean, I'll not hold you back any longer, Melissa. I think there's plenty to touch on later with Max, but there is also plenty up your sleeves, isn't there, with Surgery Connect? So let's dive in.
Yeah.
What have you got to tell us?
Well, we've had so much going on. I'm super excited to get into this today because we've got some nice updates for you. So first on the agenda was waiting room dialer. So I'm not sure if many people went on the webinar earlier in the year. I think it was June's webinar, which seems like a million miles away. We announced that we were building something called waiting room dialer. I wanted to update you all, and we are still doing this. We've been out to pilot with all of our designs, and we've had a little bit of a shift around and a redesign just to make sure it's super user friendly and easy to use. I'm not going to go into a demo on this today because it would take me the whole webinar to do it. So we'll do another one of those hopefully in November, maybe even a Christmas webinar around it if it's ready. So we're looking to be out in full pilot, so actually in use on a site by the end of this year, and then with the full launch being around March next year for you guys to all sign up to this. So it's there, it's working. We are working really hard on getting this done. I still don't like the name, so if anybody else would like to put a name forward for it, you can pop it in the chat or email us afterwards if you've got some better ideas, but we will give you a bit more of an update on that as we get through. And I'm apologizing because I'm looking at different screens, so I feel like you can see the side of my head constantly. But it brings me nicely onto the Phonebar. So as you all know, the Phonebar is my little baby. I have been trying to develop it and make it as super user friendly as possible for everybody over the last couple of years I've worked for the business. So but we've got a new version coming out. So we launched version 7 in April, May time in this year. In the meantime, we've been doing loads of improvements and trying to just really listen to your feedback and get a few bits up and running. So one of the biggest things that we have noticed is our photo requests. You weren't able to really track what had been sent, open them, you were coming up as a Windows notification, and unless you knew that you'd sent one to that patient, they kind of went into a hole of nowhere. So we've actually created what we've called a communications window. I'll come on to why it's a communications window and not a photo inbox in a minute, because we're gonna but I want to actually give you a bit of a live demo. This is a bit risky, so I'm going to put the caveats out there at the moment. I am demoing in a beta system. It's the staging environment, which is just crazy. Our developers have said, no, don't do it, it'll all break. So I've told everyone to stop touching the environment for the duration of this webinar so I can actually show you. So if I just try and stop sharing this screen. Obviously EMIS is locked, which is, you know, expected. Lucy did too much talking.
I knew it'd be my fault.
Obviously it's your fault. Okay, so hopefully you can all see the beautiful EMIS in the background and then my Phonebar at the bottom here. So before I get on to the communications window, I'm going to just show you a couple of additional enhancements that I think you'll all be really pleased about. So first things first is we are I'm going to actually have to use a foil to mobile. This isn't my mobile, it's actually someone else's in the business, because I obviously can't call in if I'm using my mobile. The soft phone in my staging environment isn't working, so I'm not going to switch on to that. However, a nice little thing that we've done here, even though it says forward to mobile, we have changed it so you can also redirect this to a landline. So if you're working from home and your mobile reception is rubbish, you can actually now forward that to a landline. So it's quite a nice little tweak that we've done there. Not the biggest showstopper in the world, but just listening to some of your feedback. So hopefully I'm going to make this call and it's all going to work seamlessly, she says with a big smile on her face, hoping that the buttons work. So what I'm going to do is I'm going to call in. I'm a patient in the surgery. I'm actually 3 patients because I've put my number in severals. What we've done is we've actually changed all of this layout for the call flow information that's come through. And as you can see, this little routing label here that's come up to show that I have my number has been stored as a post-op patient in going through a routing label. So now we can actually see the routing that has been used. I know a lot of people were putting a whisper in so that they knew where it was coming from. This kind of takes the need out for that whisper. You can now see that there's a post-op or whatever, you know, diabetes or however you've decided to use it, or maybe death or any other dementia, I think, is another one that's being used quite regular. So nothing else changed there, just the post-call, the personalized caller routing label, and just a little bit of a cleaner UI so you can see the number, what call flow I've actually called through for, what group I've come in on, and who I last spoke to. So it's just a little bit more information there to help everybody understand where that's coming from. Okay, so done that, lovely. I'm not going to talk about that at the moment because it's not working very well in the stage environment. This is the version I'll come on to that. Hang on. Don't get distracted, Melissa. Get excited. I have to control myself. Right. The other little thing, this is really tiny, but again, you guys have all been asking for it, and it's the ability to favorite people within your directory. So if you've got hospitals or care homes or pharmacies that you have to ring quite regularly, you can just favorite them and then they will pop in your favorites at the top of the list. It's as simple as that. The favoriting is for you as a user. So it's your personal favorites. It's attached to your login on your phone bar. So people within the business can have different favorites. There was a question internally that came up yesterday with regards to bulk uploading people's names. So sometimes I know that with the directory, people do a download and then a bulk upload. If you do a bulk upload, it will wipe the favorite, so you'll have to redo it again, because it's basically the bulk upload is like a delete of all of the information and then a re-upload. So just to be conscious about that. The other thing is we already had notes in the directory area, but we've actually added the notes to the colleagues as well. So this is really good for if you've got staff that maybe work part-time, or it's best to call them outside of certain hours, or if they've got other things going on, notes can be added. So these get added in the console. Config console, I never get those right. Config console. So you can pop your note in against the specific person. So that can then pull through on the phone bar. So there's just a couple of examples of that there. Not showstoppers, but just again, nice little easy functionality that just try and help your day run a little bit smoother. Okay, the only other tiny, before I get onto the communications window, I know you all can't wait to see it, is we have made a slight change in the settings for the keyboard shortcuts. Now, the keyboard shortcuts, we have been advised that sometimes are interfering with other programs, or people are pressing them by accident. So if you don't like keyboard shortcuts or you don't want to use them, we've just done a little switch at the top here, so you can just turn them off. So that just means they'll all be off. Then it's all or nothing. We did look at turning them off individually or being able to configure your own, but we just, for this first phase, to get your feedback on it, we've done an on or an off situation. So you just literally toggle it. So off is off, on is on. I know I didn't probably need to say that. I don't know why the words came out of my mouth. It's the blankness of Lucy's face. I think I felt like I had to say more words.
I mean, it's always good to be clear, especially for blank Lucy over here. But now you've brought me in, I do have a little question, given that I'm feeling a little blank right now. Going back to the patient pop-up and the labels, where would somebody put those in? Are they individual per user, or is that presumably not? That's per patient. No, so where would that go in?
The routing label is the label that's put in when you're actually configuring the personalized caller routing. So when you're putting the personalized caller routing block in Xflow, each of those routing blocks have a label in them that says, I want to route these people that have been uploaded under dementia patients to go through this process in Xflow. So that's where that label pulls through from. So you don't have to go and rename anything. It's not any additional work. It's just pulling through more information from that routing block to the callers pop up.
Fantastic.
So like the appointments. So that's the same sort of thing. So if you've got your appointments line.
My question seems to have prompted another one. What's the easiest way to check what version of the phone bar one is on? Great question.
Oh, great question. So you should be able to just press your little icon and then it should say about, and then it will tell you the version number. So as you can see, I am in risky land because I'm in a beta version and it's the second version of us trying this version. So you can check in there, or if you go to the settings, you can check here, but you can also check for updates. So that if there is an update available, it will pull that update through for you. So that's also a nice way of doing it. And if you want to see what features have been released in any kind of other updates, you can just click on release notes and that'll open up our help pages and tell you all about those new features as well. So great question.
And thanks to Peter for answering it in the chat as well. Very good.
Oh, lovely. Well done. Thank you. It's great when our users can help. Right. Now, this is a new little icon. It took us a long time to decide on this icon, so sorry if you don't like it. I am open to feedback as always. But this little icon opens up my beautiful voicemail. Sorry, it's because it said voicemail. Communications window. So try and ignore voicemail for now. I'll come to that in a minute. But what we're launching initially will be the photos. So as I mentioned earlier, the photos that you request, so I'm just going to just remind everyone how you request a photo. So we go to Billy, which is my open patient record, and then I just click on the little photo icon and I can request a photo through here. I can send it to anybody. So I'll just send this one to Chris just for ease. I'm just going to put test photo request. And then I can send that request through. The photos are free to send from our system. They don't cost any money. It's all included in your £22 a month. So that's why we're trying to enhance it so that you've got a better functionality to use our free stuff. Free stuff. Sentence, sorry. Right, so let's start with the requests. So I can see that I've sent all of these requests here. So this is the request that I have sent from my Phonebar, not other people's, just my own individual requests. I don't necessarily have sent those requests for me. I could have sent them on behalf of someone else, like Dr. Chris, as I just did. I don't think there's anything else to say about that. So I've got here George. I've sent George a photo request. As you can see, it was a testing request. I sent it yesterday. All our photo requests have to be responded to within 24 hours. But what we've done is we've put a countdown on here so you can see that this will expire. So if they haven't actually responded to the request, you can see that it expires. It will say expired and it will stay in this list when it's expired. So it doesn't disappear. It only disappears once it's responded to. So here's one I made earlier. You can see here, so this is who I've sent it to. I can click on the patient record and it will open the patient record directly in the system as well. So it's complete click through. Every time you see the patient's name, if you click on it, if it's open, it will go green. If it's not green, it's not the open record. So we're trying to keep some consistency around the colours changing when you open up the records there. Same happens with the patient pop-up. So these are all of my, these can be longer requests. You can this one expires in 23 hours because I only did it a few moments before the webinar because I was trying to get prepared. Bit of a Blue Peter. Here's one I prepared earlier. And then you've got your received. So these are the ones that have been sent to you. So as a doctor or a clinician, photo requests often go into that inbox. So rather than you having to remember who you've requested these photos for, or if people have sent them in and you've got a notification pop up and then you've forgotten about it, you can go back to here anytime and they will sit in here for 28 days. So unless they've been until they're filed. So I think Billy is probably the best one. So I've tried to put this one in as a bit more information so you can see how it would completely look. So I've got 28 days that this information will be available for. I can see that it was Billy that it was sent to, so that's the patient, and this is the date and time it came in. I can see the request that was sent to Billy to say what I needed. So thanks for your call. Need to check with the doctor beforehand. I've just made up some rubbish and thanks reception team. So that message went to the patient before they sent through their photos. So I've asked for more than one photo. So here I've got 4 in this list. The patients are able to add text as well to the photos. So if they want to describe something, they can add that in. So this is the biggest problem. It's making it very difficult to work. And sorry, I did this for Lucy. So I have a picture of my cat laying on my desk because it's making it very difficult for me to work. But you can zoom in, zoom out, do some spinnings, do whatever you want with those photos and close them. So she says close them. And I can also scan through the other photos in that list without having to navigate in and out of every single one. So it makes it super easy to view those images.
Can see who the boss is in your house. Quick question on the photo functionality from Graham. Does it integrate with the AccuRx system or any other patient triage?
No, it interacts directly with the clinical system. So just come on to that now. So I can select all of these photos and file them directly to that patient record. So that will file directly into the patient record. You don't have to select them all. Once they're filed, let's just do a couple for ease. So we're currently filing it, tells you what it's doing, and then that files directly to that patient record to keep continuity. We also have coded the request that's gone through, so photos are being requested, so they will get the SNOMED codes in them as well. So it's a fully coded solution here too. So no integration with the likes of AccuRx. They do their own photo request system. So obviously that would be a competing product. They wouldn't allow us to integrate with them. I don't think they would. I haven't spoken to them about it, so I'm talking as an assumption there. So yeah, you can see that then these ones have been filed, and then these haven't. So the filed ones will obviously stay against the patient record. You can either decide to delete these out and then they will disappear completely, or you can wait for the 28 days, and after those 28 days, those two that you haven't filed will no longer be viewable. Hopefully that makes loads of sense. It's totally instant, so hopefully, I think I did a request to Billy just before the call, so I'm hoping that what's Billy's date of birth? So I don't know if everyone knows this, but this is what the patient sees. They just get a little confirm your date of birth, which Billy's is the 24th of June 1978. So then they get photo requests, and then the text that I've said, this just says test photo requested, nothing too interesting. And then we get to choose photos. They just pick from their library. Let's try not to pick anything too crazy. Let's just go for that. Easy. They can add comment. So test comment, done. And then agree and send the photos. So you can see, I just wanted you to see how quick and instant this is. So that's just waiting to send from my end. Not that you can see that because it's just a white background. I'll make it appear. No, it's
Whilst
still sending.
Whilst we're
Yes.
waiting, another question. Does the communication feature charge the practice per SMS or use the ICB SMS portal like other triage tools?
Neither. These are completely included within your £22 a month license fee. So there's no additional charge. EMIS is just locked. There is no additional charge for sending photo requests from our system for the practice or the ICB. There's no, it's a free.
Oh.
Free. It's free. So whilst it's sending a SMS, it's sending it via our photo request feature, which we don't have a charge associated to.
Fantastic. I hope that one answers your question, Jason. Always like an answer that ends in free. Just skipping back to the phone bar, because there was a good question from Elizabeth. Does the update mean that you have to update each phone bar within the surgery every time you update? So when you click on the updates, do you have to do that on every individual phone bar user?
So every individual phone bar user should get pushed the update, so it should go automatically through, unless you have had the update installed from your IT team, at which point the IT team will need to push that through. So it depends on how you've installed our product, but it will automatically push, providing you haven't gone through the IT team to install it. I think that makes sense, hopefully.
Made sense to me, which is always a good sign. One more question just before we move on. From Jason again. Can we export the directory to be able to import it into other practices, for example, using it across a PCN?
Yes, I believe if you go to the config console, you can download the directory and upload a bulk upload. So I think it's completely, but I'd have to triple check that. Maybe check with your CRM manager or call the support team if you want help doing that, because I'm slightly
You are
sure.
Always there to help.
Always there to help. Okay. Is that all on my photos? Why haven't I sent my photo request? I think everything went a bit weird there. So I think I cancelled it accidentally when the system locked. So let me just.
Are we near the end of the Phonebar update, Melissa? Because I'm just really conscious of time, and we've got Max on the call.
Oh my God, yeah, I can see that. Right, totally. So yes, we are more or less there. I just really wanted to so this release will be coming out at the end. Start releasing next week, sorry, so the 21st. We will start rolling out version 7.1 to everybody, and version 7.2 with voicemails will come next month, but we'll do a bigger update on that because I'm running out of time, and I've only given Max a whole 5 minutes to tell us all about why he is here on the call. And I can only apologize for being a chatterbox. So hopefully, I'm just going to go back to the slideshow and it will all work lovely. Let me just home back.
I was going to give you a big dramatic intro, Max, but I think we've run out of time. So maybe you could just dive in and tell us all about it. What's the news?
Yeah, fantastic. Thank you, Lucy. Yeah, so the news is that some of you, and I know that many of our partners and people we've worked with over the last few years under Hanley Consulting, where we've worked with you on these amazing access optimization programs. I'm going to put in a link to one of the programs we ran at Tudor Lodge in Southwest London. I know that Prash is on the call. The result of that pilot, that 12-month access optimization program, is why we're all here today, and why the EDAT digital assistant is now part of the Exon family, is because together we can go further. We know that there's so much we can do together, because from Hanley Consulting, what we look at is access across the whole of primary care. So all of the demand coming into the GP surgery, we know that it could be better served elsewhere. So we developed a digital assistant which can help automatically signpost patients, whether it's PCN services, community services, or more importantly, self-service. We know that patients are happy to serve themselves. They just need a bit of guidance on how to do that or where to do that. So first thing I'm going to announce is the dashboard. Lots of people on the call again. They're very, very aware of the dashboard. We've been working with you hand in hand over the last 12 to 18 months to really make huge impactful changes to your patient's experience. So what we've developed here is a dashboard that's now available to all Surgery Connect customers and non-Surgery Connect customers. But if you are a Surgery Connect customer, you will have the full extent of all of your telephony data brought into one single solution, as you can see on screen, which will also incorporate your online consultation data, which we can drill down into pathways. We can find out exactly why people are accessing your online consultation tool, the path they're going through and where they're ending up, which is amazing when you can look at planning resources and allocating staff around that, or maybe digital pathways. We're also including NHS app uptake. More importantly than uptake is usage. So we can actually recognize increasing spikes in NHS app uptake. And amazingly, there's tabs on the left-hand side. We're showing how often we're signposting to community, how much time we're actually saving in practice by digitally enabling our patients. So this dashboard is available now to all Surgery Connect customers. And I'd like to add that please do reach out to your CRM. I've got 3.5 minutes. Please reach out to your customer relations manager for more information on the dashboard. It's amazing. It's a one-stop shop. It's not being done anywhere else in primary care. It's got your telephone data, online consultation data, NHS app data. We're looking into workforce wellbeing. That is available within it now. So we're more than happy to help with staff surveys and everything like that. So I'll pop in the case study from Tudor Lodge from Southwest London, where we can show you the impacts over the 12-month period. Just looking at some data, calls for appointments into the surgery dropped by 48% after our program. Calls entering call queue down by 23%. And amazingly, the missed calls, they're missing 75% less calls through this program. So I'll drop a link into the chat, but the dashboard is readily available. We do all of the work for you, all of the heavy lifting around the data. You no longer have to travel through CSVs and lose your login to your online consultation tool dashboard. We will manage all of that for you at Exon with the Surgery Assist dashboard. So yeah, please do get in touch if you want more information on that. And then the big one is the product, Lucy, if you move to the next stage. So we do now have the digital assistant, formerly known as EDAT. You may know that the whole focus of our program is enabling digital access through telephony. You could say we'd planned it. We've now partnered with the biggest and best telephony provider in the country to further enhance the product, but more so further enhance the benefits to your patients and your staff. So what Surgery Assist will do is it will capture the patient at the point of need, upskill them digitally, support them with downloading the NHS app, support them with viewing their test results, or perhaps even if they would usually go through to the online consultation tool, we can capture them and navigate them through to a more appropriate service, such as community and PCN service. And again, please do contact your customer relations manager from Exon Health for more information on that. And we can book in a demo with myself or one of your regional managers. And on screen, you can see, thanks, Melissa, a very intuitive step-by-step guide of a patient going through the automated assistant. And and that's that's everything from me. I'll drop the case study into the chat, but I hope it piques a lot of interest because the outcomes speak for themselves. Thanks, Lucy.
Absolutely second that emotion. And I think Name's asked a really important question on the chat that you probably need to just address. There are folks that, of course, signed up to Hanley Consulting's EDAT chatbot. In any way, does it affect those practices now that you have joined forces with us and rebranded as Surgery Assist?
It will only enhance the experience for patients. So the beautiful thing about this partnership is we can work with Melissa and the product team at Exon to ensure that there's even more smoother integrations from the product. I won't announce too many features that will be included there because we've got it all in the roadmap. But again, if there's any specific queries of what we're building and what we're soon to launch, please do get in touch. But it will only enhance that experience. There's no immediate change. It's just that better integration we can get for those patient journeys. So super excited about this partnership.
And that's a wrap from us, I guess. There's still some unaddressed issues in the chat, but I think one thing that might be worth doing, if you do want these CRMs that we keep talking about to reach out to you, maybe just put in the chat the surgery that you're at, you name the surgery that you're at, and let us know that you'd like a little bit of extra support because we can get in touch with you directly. But that is it from us today. Oh, no, it's not. There is one additional thing I'd like to just mention, and that is a shameless plug for our access optimization webinars that are going to start again in November, early November. So do look out for more information on those. That's it from us for today. I hope you've enjoyed it. There's been a lot that we tried to jam pack in. There will be more webinars coming so that we can go into a little bit more detail on the stuff that you want to know about. So let us know what you want to know about. If you'd like any further information, as I say, pop your surgery name in the chat. We'll get the CRMs to get in touch with you directly. We will also make the recording of today available in the next couple of days for all registered attendees. I will send that out, hopefully with all the right information in this time. And we'll see you around the same time next month for more. All right, in the meantime, on the behalf of the entire Exon Health family, which now includes Hanley Consulting, have a happy and healthy October, and we'll see you again next month. Take care. Thank you.
Amazing. Thank you.
Bye-bye.
Bye-bye.
Bye-bye.